Hello, my dear students. I'm Dr. Vaishaly Bharambe. I've been teaching anatomy for last 25 years and I love it. We are going to study general anatomy of bones. This will be taken in the form of 2 lectures, part 1 that is today and part 2, the link for which is given in the description section. I want you to see both and get the topic in its entirety. What are we covering today? We're going to talk about classification of bones. It's by structure, region, ossification, shape. Towards the end, I'm going to be taking a short note of sesamoid bone, which is a very commonly asked question for undergraduate students. So wait till the end and study the sesamoid bone and the entire topic well. Let's begin then, okay? Let's begin by asking ourselves, what is the bone? Yes, you know that we already know the answer to it. The bone is a highly mineralized, rigid connective tissue. Is it a normal connective tissue or a specialized? Yes, it's a specialized connective tissue and it's highly vascular. It's constantly changing. Okay, so let's see if we get this. It's a specialized connective tissue? Yes. It's rigid due to mineralization? Yes. It's vascular? Of course. And it's constantly changing? Yes, it's something, this may be a little new to you. See, your bone is never the same. As you gain weight, the bone remodels itself. As you lose weight, as you age, do you remember how your grandparents' legs tend to become bow-shaped as they age? That's constantly changing bone. Okay, it's never the same. All right. With this, let's come to what functions does this bone perform. Again, you don't have to study your general anatomy book. You already know the answer, isn't it? So, 1, it's rigid. It provides rigidity to your body. It acts as a lever for action of muscles. I want to contract my muscle. The lever is the bone. The joint formed by the bone is the lever. It gives motility. Can you walk without bones? How many of you have seen Harry Potter? Do you remember what happened when his bones melted? Go, read Harry Potter again, enjoy. Okay. Then it contains bone marrow, so it gives you blood cells. Yes, it's a storehouse of calcium and phosphorus. And yes, it provides protection. See, my skull is protecting my brain. My ribs and sternum are protecting my heart and lung. So it's very much a protective organ. Okay, so with this, we've done the definition of bone, we are done with the functions of bone. Let's now go to its structure. I'm just showing you here a section through the femur, which shows you how. It contains an outer compact bone. You know all this, okay? Just run it through your brain and you will not forget it. Outer compact bone in a spongy bone. Outer bone is covered on the outside by outer periosteum, lined on the inside by endosteum. बाहर से क्या है? Periosteum. अंदर से क्या है? Endosteum. And in the core of the bone, you have the medullary cavity. उसके अंदर क्या है? What do you have inside it? Yes, you have the bone marrow. That's it. That's your compact bone, or that's the section of any bone. Right. So on the basis of this information, let's begin classification of bone. Okay, so bone is classified. Take a look at this image. You can see how it has an outer compact bone and inner cancellous bone. Okay, both are mature. Don't think that the cancellous bone is not mature. Both are mature. But in compact bone, the bone tissue is very compactly packed with minimal spaces. In cancellous tissue, the trabeculae are far apart, providing space for bone marrow. Okay, so on the basis of structure, compact bone and cancellous bone. On the basis of location, yes, you already know this. Look at this image and you know what I'm talking about. Bones that are placed in the central axis of the body are called axial bones. That means which bones? Skull, vertebrae, ribs, sternum, and of course the sacrum as well. Appendicular are those that are related to your 2 limbs, the upper limb and the lower limb. These are going to be appendicular. So, axial are central bones, appendicular are bones related to upper limb and lower limb. Fine. So, second classification done. Let's go to Classification as per ossification. Now this is new, not taught in school. Let's understand this. Membrane bone. See, sometimes bones are formed in the body, for example in your skull, with formation of one bone. See the image here. One membrane is formed, new bone is laid on top of it, and laid on top of it, and on top of it, and on top of it, and thus a membrane. The bone is formed on the basis of a membrane. Such bones are called membrane bones. For example, flat bones of your skull. Let's go to another situation, students. Now, you can see some images. This one, there is formation of a cartilaginous model. For example, when I was a baby and in my arm, the bone was not formed. A cartilaginous model was formed. Slowly, blood vessels entered into that model and began to deposit calcium in the cartilage, resulting in the process of ossification. This area where bone formation first took place is called as primary center of ossification. What happened? Think again. One cartilaginous model, blood vessels supply it, they result in early bone formation. That area where bone formation first starts in the cartilage is called the primary center of ossification. Looking at the image, can you tell me what develops from this primary center of ossification? Yes, what develops is called diaphysis. The shaft of the long bone is developed from primary center of ossification. Slowly, as you can see in the next image, blood vessels begin to enter at the two ends, and everywhere they create small globules of bone formation. Each is referred to as a secondary center of ossification. Okay, so primary is when it is formed first, secondary is when it is formed after that. Okay, each of these secondary centers develops into what is called as epiphysis. The shaft is diaphysis and the ends where bone formation takes place are called as epiphysis. A bone that develops in this manner from early formation of a cartilage model to ossification and formation of bone is called as cartilaginous bone. So how many types of bone you saw? One which develops in the form of a membrane, one which develops in the form of cartilage. And then you have something in between, membrano-cartilaginous. Okay, so by the ossification, you've got three types of bone: membranous ossification, cartilaginous ossification, membrano-cartilaginous. Therefore, membranous bone, cartilaginous bone, and membrano-cartilaginous bone. The examples are given, you must learn them up, they can come as MCQs. Let's finally come to something which again you are familiar with. Classification of bone based on its shape. If it's long, we'll call it long bone, short bone, flat bone, pneumatic bone, irregular, sesamoid and accessory bones. This is very comfortable, easy to understand information, isn't it? But in medicine, we learn a little more. So let's talk about these long bones. As you can see, when the bone is long, its length being more than its breadth. For example, now here, you are seeing a long bone. Its length is more than its width. So I'm going to call it long bone. What are its other features? Let's try to understand. It's got two ends and a shaft. Okay, yes, you can see in the image two ends and a shaft. It has got a medullary cavity in the center. Okay, so this is the cartilaginous model. As you can see, the bone is ossifying. The primary center developing to form diaphysis. The secondary centers developing to form epiphysis. We just did this. Now let's take this into features of long bone. Each long bone ossifies in cartilage and has a diaphysis and at least two epiphyses. Got it? Why we did all this? Its length is more than its breadth. Okay. It has two ends and a shaft which contains medullary cavity. It develops in cartilage, and as it develops, it has got a central portion which we call diaphysis, and it has two or more epiphyses. Okay, right. It is situated along the long axis of the body. Look at the image there, and it transmits body weight. All these factors, when they come together, you call it a long bone. For example, femur, humerus, tibia, and so on. I want you to revise this once more. What is a long bone? When the length of the bone is more than its width, I want to call it long. It has two ends and a shaft. If I cut it through, I will find a medullary cavity in the center. It ossifies in the form of a cartilage. It has diaphysis and two or more epiphysis. It is situated along the long axis of the body and it transmits body weight. Got it? So, this is what is a long bone. Now, let's talk about those bones, which appear long, but still something is different. Let's take a look. Here I can see clavicle. Yes, it is long bone, isn't it? It looks long. It has two ends and a shaft. Fine, looks long, but it is devoid of medullary cavity. Were you to cut the clavicle, you won't find a medullary cavity in it. And it ossifies in membrane. Any other feature you can think of? Yes, it's situated along the horizontal axis of the body. Normally, long bones are situated along the longitudinal axis of the body. That is why I'm going to call it a modified long bone. Let's go to another example. Can you see this? The body of vertebra. Don't see the entire bone. Just see the body of vertebra. It transmits weight. Yes. It has two ends and a shaft. Yes. Long bone. But it is devoid of medullary cavity. So it does not meet all criteria of long bone. Therefore, what do I call it? A modified long bone. Got it? This is how we understand the subcategories in the category of long bone. There is one more subcategory, students, called as miniature long bone. I'll just show you an example now. Now, each of these is a miniature long bone. Why is it miniature? Just observe these metacarpals, okay? Why is it miniature? Because normally there is a diaphysis and there are two epiphyses. In this case, there is a diaphysis but only one epiphysis. That's why I'm going to call it miniature long bone. So how many long bones? We saw features of typical long bone. We saw what is modified long bone, how clavicle and body of vertebra are modified long bones. Then we talked about miniature long bone, which is metacarpal, metatarsal. We're done with long bones. Let's go to the next category. Before that, students, if you're enjoying this lecture, then please give me a like. Please subscribe, okay? And this will encourage me to create more of such informative videos for you. So please do like and subscribe. I hope you've done it. Let's go to short bones. Also, what is a short bone? Common sense, chota sa hoga, madam. Yes, chota sa bone hota hai, but it has got 6 sides. It's like a cube, okay? Out of which 4 sides are usually articulating with something or the other. And 2 sides are usually giving attachment to muscles. So what are the examples of short bones? The carpals and the tarsals, okay? All these bones in your hand or the bones of the foot are short bones. Most of them have the primary center of ossification appearing after birth, okay? This I will discuss more in the second part of general anatomy. Just understand talus, calcaneus and navicular. One second. So these bones, the talus, the calcaneus and the navicular, they have their primary centers appearing before birth. Okay, but otherwise all the tarsals and carpals have their primary centers of ossification appearing after birth. Okay, so let's go to the next variety. Why am I teaching you all this? Comes as an MCQ. Right, pneumatic bone. Pneuma means air. Obviously, it is something that bone contains air in it. Which bone do you know which contains air? Of course, our skull. So the air can be in the form of large pockets or in the form of tiny little pockets. Large pocket of air, your maxilla. Small pockets, your temporal bone, the mastoid process of temporal mastoid air cells. These are all examples of pneumatic bone. Why do we have air in our skull? Why do you want air? You want air because you want to reduce the weight of your skull. You're roaming, when you have a cold and you have your sinuses full of mucus, what happens to you? You feel heavy-headed. You're holding your head, you're saying, Sir, bhari hai, doctor, kuch to karo. Can you imagine living like that for life? So yes, you don't want a heavy head. You want your skull to be light. So the air spaces have been created to reduce weight of the bone. Another thing is when you have a cold, your voice changes. You have this peculiar nasal twang. Yes, you have a nasal twang. Why? Because the air is not, the sound that you are creating is not getting modified anymore. These pneumatic bones result in modification of sound. Besides that, they also moisten the air that you breathe. If you are in a very dry place, you need that air to be moistened, otherwise it will damage your lungs. So that job is also done by pneumatic bones. Remember, you get a short note on this. Right. Irregular bone, as the image suggests, you know that hip bones which have no particular shape are typical examples of irregular bone, or bones at the base of the skull also. Flat bones, again common sense, bones that appear flat. Usually they will have an outer table, an inner table and a tissue in between. Okay, if you were to take a section of your skull, one second, I will show you. So if you look at this carefully now, you will be able to see that there is an outer table, an inner table and a diploid tissue in between. Okay, so this is typically what we see in flat bones. Very important thing you should know, flat bones are protective by nature. They are created for protection. For example, my skull is flat bone. What is it protecting? My brain. My sternum, my ribs are flat bones. What are they protecting? They are protecting my lungs and heart. So flat bones are essentially protective by nature. Fine. Let's talk about one last category, accessory bones. These are bones which are created because a separate ossification center developed, which normally would not have developed. But it develops. For example, take a look at this image. You're seeing a bone here which is developed inside the lambdoid suture because it developed its own primary center of ossification. So you are thinking, ma'am, why are you telling us all this? Do we really have to know? You have to know, my dear students, because when you see an X-ray and you see a separate tiny bone, if you have not studied anatomy, you will say, Arey, dekho, see, there is a fracture. But if you have studied, you know that it's a Vermean bone or a sutural bone. Okay, so that is why you have to know about it. Finally, let's come to, so that's the clinical importance. One question for you, what are Gothe's ossicles? Try to find out, put the answer in the comment section. Right. So this is what we've done. We did short bones, pneumatic, irregular, flat and accessory bones in last few minutes. Let's now come to one of the most important topics for undergraduate, first MBBS students, sesamoid bones. So also for dental students. It's a very commonly asked short note. So what is sesamoid bone? It's a bone that looks like a sesame seed. For those who don't know, okay, til, T-I-L. Okay, the bone that looks like a sesame seed was so called as the sesamoid bone. Okay, these are tiny oval nodules, a few millimeters to several centimeters in diameter. They vary in shape and size. What are they made up of? They can be made of cartilage, they can be made of bone, fibrous tissue or a mixture of all. Okay, it's very variable. It can be fibrous, cartilaginous, bone or mix. Okay. Now let's go to examples. As I talk examples, you will find yourself relating to this topic. So let's take a look at the first and the most famous sesamoid bone, the patella, formed in the tendon of quadriceps femoris. The next one here, pisiform, formed in the tendon of, yes, flexor carpi ulnaris. Another one is, take a look at this X-ray here. Can you see two bones here? These are sesamoid bones formed in the tendon of flexor hallucis brevis. Again, in an X-ray of your hand, you will find some sesamoid bones in your hand as well, formed in the tendon of adductor pollicis and flexor pollicis brevis. Now we come to those which may not always be present. For example, You may find a sesamoid bone in peroneus longus, in tibialis anterior. Okay, let's talk about a viva question. What is fabella? Fabella is a sesamoid bone formed in the tendon of lateral head of gastrocnemius. Another question, what is rider's bone? Again, a sesamoid bone formed in the tendon of adductor longus. This is seen in people who ride long periods of time. Because of friction to the adductor longus, it develops a bone in it. So these are all examples of sesamoid bone. You are expected to know all of them. Okay, right. Let's now come to features of sesamoid and how do we remember them. So I have a mnemonic here. The owls always prefer hooting. Just take the first letter of it, T. T stands for sesamoid bones are bones formed in the tendon of a muscle. O, ossify. These are bones that ossify late in life. For example, in case of sesamoid bone, ossification takes place in case of patella at around age of 12. A stands for they all usually have an articular cartilage on one of its surfaces. Okay, many times they have an articular cartilage on one of their surfaces. P stands for no periosteum. H stands for no Haversian system. Let's do this once again. TOAPH. T stands for formed in the tendon of a muscle. O, ossifies late, maybe even at an age of 12. A, it always has or many times has an articular cartilage covering it. P, no periosteum. H, no Haversian system. Got it? So use the mnemonic but get all your features in place. Right. Let's now talk about functions. What do they do? Rainbows make awesome colors. R, it resists the pressure of overlying muscle. M, minimizes the friction between the muscle and the underlying bone. A, it alters the direction of action of the muscle. And C, it helps in improving circulation over that surrounding tissue. Do this once more. R stands for resists pressure of overlying muscle on underlying tissue, minimizes friction between these two, alters direction of action of the muscle, and C stands for improves circulation. These are functions of sesamoid bone. So let's revise. How will you write the short note now? You will describe what is the meaning of sesamoid bone. You will give its basic shape, size, material. Then you will give examples. I have given you about 8. You should know all. What are the features? There are 5 features. And what are the functions? There are 4 functions. Get all these down. Use mnemonics wherever necessary. But get your full marks for a sesamoid bone. Believe me, they'll ask you invariably. Right. So again, my dear students, if you like this lecture, do please give me a like. Okay, subscribe to my channel. And please share your comments in the comment section. It will tell me what is working for you and what is not, so that I can keep making these informative lectures for you. So the next lecture contains blood supply of long bone, which is another very important topic for all of you. So do please go, and the link for this lecture is given in the description section. Do please go and check out that lecture as well. Happy learning, students. It was my pleasure to take this class with you. I hope you enjoyed it. See you across the screen in some other video. Thank you.